this is how our digital infrastructure and being so integrated, you know, the shared care record, integrating with the person health record, integrating with the intelligence platforms, allows us now to do some really exciting things when we're looking at a specialism, and we'll take COVID as a specialism there. So the virtual ward, as Graphnet have termed it, sits within our person health record. It's an app. It's available on all your normal app buyers. If you just go back up, and you can see, it'll be very tiny for you, but these slides will be coming out in the top left box, what that app looks like for the patient. This is not a medical device, so it's supporting our pulse oximetry program, where our out of hours provider for Slough rings the residents once a day to take their oxygen readings with them. And we've obviously already previously delivered out the pulse oximeter to those patients. But if they want to use an app for self-recording, they can. And obviously one of our key priorities is to support our residents knowing themselves and supporting themselves. So it allows them to be active in the programme. That flows through into the virtual hub for our provider, which sits in our shared care record at CareCentric. And then you can see that they have a daily summary to record. Can we go down to the next slide, Mark? So this is the sort of PHR readings that you'd see, the history that you'd see from the patient in the virtual hub for those people providing this service. And there are a lot of apps out there for remote monitoring, so I don't think this will be particularly surprising to you. It's sort of the value add an integrated program can bring to that. So next slide, Dan. And this is where we get a bit clever really. So you can see the remote monitoring COVID diary, but to the right there, you can see that the virtual list that we showed you in our population health platform, we can now repopulate directly into our provider as a candidate list of the patients that they then enroll onto their screen to watch their virtual readings. And we haven't got a slide about this, but the next thing, which I'm really excited about for direct care, is that when those oxygen readings are being monitored within the virtual hub, we can then flow that information back into the shared care record. So if one of those patients on pulse oximetry arrives at A&E at 3 a.m, the doctor who's reviewing them will be able to see what their O2 sats have been doing in the previous days. And I think that's going to make a big difference for the speed of decision making at our front doors.